Cytokine release syndrome, or CRS, is a large-scale activation of the immune system, and that's not new to us in medicine. You can see this happen after infection. Some people who had COVID-19 had a severe systemic activation of their immune system. We can see it with certain cancers. In this case, we are triggering it because we are either giving people CAR T cells, which are these T cells which are targeted toward the cancer, or we're giving what are called bispecific T cell engagers, or BiTE therapies, which activate the T cells, binding them to the tumor cells. There are probably many mechanisms for how this happens. We don't understand all the way that the immune system gets activated, but we do know that the T cells themselves, when they are activated, release cytokines, and most of the damage and the inflammation seems to be from what are called macrophages or monocytes. And these are immune system cells that are very powerful. They're found throughout your blood and your tissues, and they release a lot of inflammatory cytokines themselves, a lot of inflammatory mediators, and they also recruit a lot of parts of your immune system as part of the inflammatory response. So they're very powerful. And then the damaged cells themselves that have been attacked by these T cells also actually release proteins or molecules, I guess, that further activate these macrophages and these monocytes and further activate the immune system. So you end up with this cascade effect of this massive immune cell activation, and that can cause a lot of damage to parts of the body. As far as how that looks when you receive this therapy, usually it happens within it can be as early as 1 day after you receive the treatment. It can be up to a week or so after the treatment. And if in the early stages, it looks a bit like the flu. So you might have some fever, you might have some shakes, maybe feel a few aches and pains. So it just feels maybe like you have a mild to moderate flu. We can treat that usually with what we call supportive care. That will be some medications, maybe like acetaminophen to bring down your temperature. We might give you some fluids if you need that. We will often treat with antibiotics because we can't be sure that there's no infection there as well. But that might really be all you need, is this supportive care. If it becomes more severe, you might have trouble breathing. You might require some oxygen replacement treatment. When you're getting to that stage, we're usually starting to talk to our colleagues in the intensive care unit, and we start to give a treatment for the actual cytokine release syndrome. And the first step is a drug called tocilizumab, which is itself an antibody, but it's an antibody against one of the inflammatory mediators, and this can help to make the response less severe. If it progresses beyond that and you actually need more oxygen support, you might even need to be on a ventilator or some other oxygen support. Or if you're needing support for your blood pressure drops too low and you need to get medications to bring it back up. In that case, we really do need intensive care unit care and monitoring during that time. And we start adding usually steroids at that point to try to further reduce the immune response. It's hard to prevent this because activating your immune system to help fight your cancer is actually what we're trying to do. And this is sort of the collateral damage. This is the fallout from doing that. So it's actually very difficult to prevent this. The drugs that we often use to prevent severe immune system activation with other forms of antibody treatment, like steroids, we can't use here because we will prevent the activation of the immune system that we want to see happen. So we can give it afterwards, but we don't give it as a preventative measure. The best we can really do is try to optimize the patient's health as much as possible ahead of time. So make sure that if they're going into CAR T cell therapy, if you have a higher burden of disease, you have more cancer cells in your body, you're more likely to get a CRS. And so bringing that burden down may help to reduce the chance that this is going to happen. Try to make sure that you're in your sort of optimal physical shape and that we're monitoring you closely for these side effects. So there isn't a great prevention, but we can get patients through the worst of it. Even with a severe CRS, we can generally get people through and get them out the other side with really good supportive care and treatments like I've talked about.